Welcome, everyone, to our Introduction to Veterinary Homeopathy lecture. We are the Pitcairn Institute of Veterinary Homeopathy, and we've been training veterinarians in classical homeopathy since 1992. This year, we're celebrating 33 years of providing educational programs and currently offer courses, online, webinars, and in-person annual conferences for our course participants and graduates. Our program was founded by the pioneer in veterinary homeopathic education, Dr. Richard Pitcairn, who many of you will know already from his books and interviews and articles. My name is Dr. Sarah Stieg, and I'm the director of the program. I'll be lecturing you tonight along with faculty member Dr. Andrea Tassi, and between the two of us, you have over 45 years of combined homeopathic clinical experience to share with you tonight. So we're going to begin with some brief introductions of ourselves. So a little bit about me. Like most of you, I wanted to be a veterinarian since I was 4 years old, but I have a rather unusual journey because I was introduced to homeopathy as a teenager. And so I started studying homeopathy long before I went to veterinary school. And rather uniquely, I actually went to veterinary school to become a veterinary homeopath. And I was fortunate enough to receive the blessing from Dr. Richard Pitcairn to go ahead and take the program while I was still in veterinary school. And I became the first veterinary student to ever graduate from the professional course in veterinary homeopathy. So on graduation, I entered homeopathic clinical practice. And then in the years that followed, I began teaching for the program, presenting at our annual meetings in AVH. And in January 2013, I became the director of the Pitcairn Institute of Veterinary Homeopathy. In addition to the PIVH, I currently have a mobile small animal and equine veterinary practice in North Yorkshire, England, focusing 100% on classical homeopathy. I act as a primary care provider to all of my patients, and I provide a 24-hour service. So enough about me. Andrea, would you like to go introduce yourself to everyone?
Sure. Again, thanks everybody for joining us this evening. I know everybody is busy. I'm speaking to you from Northern Virginia, just outside of Washington, D.C., where I have a house call based cat-only practice where my aim is to have homeopathy be my primary modality. Again, I'm also a primary care provider for my clients and their cats. I did not even know what homeopathy was when I graduated from vet school in 1988, and I practiced for a long time in I think, a pretty academically rigorous sort of way, but got frustrated that there were many, many things that I couldn't get my patients better from, or I'd get them better from one thing and they'd go on to another. And in a search for something else, I was directed by a colleague to consider looking into homeopathy. And when I read a book on homeopathy, it sort of put 20 years of practice into context. And I said, this is what I want to do. And I studied with Dr. Pitcairn back in the days when the course was broken into two parts. We now have combined both parts of the course into the master course and added a lot of really nice casework improvements. And for me, it's just been a wonderful journey and made me much happier with what I do. And I really feel like I'm helping my patients more. Cats and homeopathy are a great combination, but really any living thing in homeopathy is a great combination.
All right, so the goals of our introductory presentation tonight are going to begin with introducing you to homeopathic theory, and we'll begin by comparing the allopathic to homeopathic approach to disease. We'll review the role of the vital force in the law of similars. We'll discuss the origins of homeopathy to contextualize the homeopathic development for you. We'll then get into the applications in veterinary practice and discuss the difference between acute versus chronic disease treatment, which is very important in order to know how to prescribe successfully. We'll then delve into some exciting case presentations that should bring all that homeopathic theory to life. And then we'll briefly discuss where you can get homeopathic training, certification, and continuing education. We'll provide you with a recommended reading list and resources. Now, our programs are designed for veterinarians and those with medical training. I know that many of you tonight are, coming from various different backgrounds, some with medical training, some with not. So we're going to try to pitch our talk so everyone understands us tonight. All right, I'm going to pass it over to Dr. Tassi to begin.
Okay. We can go to, yeah. So I think if we're going to discuss homeopathy, I think what we have to first set the tone of is sort of what the difference is, homeopathy to conventional medicine. And we're going to refer to conventional medicine as allopathic medicine because according to Hippocrates' description, allopathy was based on the principle, or is based on the principle of contraria contraris curantur, which basically is saying that we will cure by using something that is different or opposite. This system is a system that is based in a physical sense of a primary reality, that the physical organism is the real thing, that when we are looking at a living thing, an animal, a person, that sort of what we see is what we get, the physical mass and the structures and what we're made up of that we can weigh or take a picture or run a laboratory test on, that is the primary reality. And this system views disease as some alteration of that physical structure or the functions of the organs in the structure, etc. And by that reasoning, when the patient has symptoms, when the machine goes wrong, the system of medicine's goal is to counteract those symptoms, block their symptoms, using medicines that work on a physical level to remove those physical symptoms. And this whole model is called scientific materialism. And this is the kind of orthodox model of anybody with any biology, science, medical, paramedical training. This is the dominant paradigm, especially in Western medicine. And it's basically saying that all reality comes from a material foundation. We can go to the next slide. So, how does the conventional allopathic system approach disease and the treatment of disease? Well, any of you who are in medical practice to any degree sort of know that there's this structure that is followed when we are approaching a sick patient. And the first part of that structure is sort of the idea of making a diagnosis, that we're going to place the patient into some named category of disease by virtue of our physical examination or laboratory tests or other diagnostic testing. So we might see a cat and run some blood work and say that cat has kidney or renal disease, or diagnose it with hyperthyroidism, or we meet a Labrador that's got hair loss and high cortisol levels, and we will say that that dog has Cushing's disease. Once we have that labeled diagnostic category that we've put the patient in, then there's a certain almost cookbook-like way of then saying, well, what are the drugs that we use to make the symptoms of that disease go away? Because in general, the approach to allopathic treatment of disease is to suppress the disease symptoms, because that is the disease in this modality. And so this is where we reach for things like antibiotics for infection, anti-inflammatories for swelling, antiemetics or anti-nausea meds for nausea and vomiting, immunosuppressants for autoimmune disease. You almost see this opposition where we talk about we're curing with opposites. We even see this in the names of the medications that we're using. antibiotic, anti-inflammatory, anti-emetic. Any of us who have been in practice will see that, especially when we're treating chronic disease, when we're treating a patient in this way, we typically need to keep repeating our medicines, our drugs over time. If we stop the medicines, we will generally see symptoms return for patients. And most all of us are familiar with the long list of side effects that's possible from any drug, even some of the drugs we think of as safest. Um, so this is kind of the model that most of us are familiar with because this dominates medicine, especially in, say, the Western world. Let's move on to our next slide. So let's contrast that with a homeopathic approach to disease, because here, instead of what you see is what you get kind of thing that in the material phenomenon, there is more than meets the eye in what we refer to as the vitalist model. Because the homeopathic perspective views the nature of reality kind of in the opposite direction of the allopathic model. That the most fundamental thing is not the physical matter of the living thing, but an energetic essence or origin or animating presence that is in advance, that is a priori before the physical presence of the organism or the development of disease. And we refer to this energetic essence as the life force or the vital force. And we believe that it is the vital force. Homeopathic theory says this is actually what is responsible for bringing us into existence. The form of any living being is determined by its vital force. And this is from something as small as a microbe to as big as California redwood and every animal in between, including us human animals. And because it acknowledges this as the fundamental sort of building block of things, we view disease, illness, disturbed health as actually occurring at that level. Disease is when there is a distortion or a mistunement of the vital force. Now, we're not saying physical symptoms don't exist, but we give them a different interpretation because in our way of looking at things, the expression of this mistunement of the vital force is what produces the symptoms. But the symptoms are not the disease, simply the expression of the vital force's response to the disease. Everybody got that? It's a very fundamental thing, but very important building block of homeopathy. So the vital force, any of you who have studied or had experience with Chinese medicine are probably saying, oh, isn't this qi? And yes, that's exactly what this is referred to in qi. And most other, what are referred to as alternative or complementary modalities, do acknowledge this energetic essence and sometimes give it different names. Conventional allopathic medicine is kind of the only medicine that leaves this out. But the role of the vital force is to create balance and normal function. As I said, it's the energy that allows an organism to grow and develop the body and the form and the maturity that it's supposed to have, and then maintain it in optimal health, basically by maintaining homeostasis. The vital force, when it has a challenge, something that requires it to sort of defend itself, its response to this is to create symptoms. And the goal of this response, what the vital force is doing, its best effort in creating these symptoms, it's trying to free the body from the disease, from the mistunement. But it can't always do that without some help. We as homeopaths listen to the vital force. We listen to the language of the vital force by saying, oh, the symptoms, the patient's symptoms, the totality of symptoms, everything the patient is showing us, that is our guidance to finding the one homeopathic remedy, also called a homeopathic medicine. I'll use those terms interchangeably, remedy, medicine, because the right homeopathic medicine will, when administered, it will allow the vital force to sort of rise up and release the disease and return to normal function. So we are using the vital force as our healing tool. We're helping the vital force heal itself. Let's move on to the next slide. And in doing this, we apply a different principle. Where allopathy looks to cure with opposites, we are looking to cure with the law of similars. And anybody who's heard a little bit about homeopathy usually has heard the phrase of like cures like, which in Latin is similia similibus curantur. Let likes be cured by like. And our founding father of homeopathy, Dr. Samuel Hahnemann, who we'll talk about a little bit more, basically discovered this principle. And it really, to say it as simply as possible, is if any medicine that can produce symptoms in a healthy patient, symptoms of disease, often referred to by the old term as morbid symptoms. If we can cause these symptoms in a healthy patient with a medicine, this same medicine will be able to remove similar symptoms that are occurring in the ill patient as an expression of their mistunement, their disease. And in homeopathy, because we are looking at the patient as an individual, we are using the language of the vital force. We're not placing a label on them as a diagnosis. We are individualizing based on what the patient is telling us by their symptoms. And I'll just give you a brief example. I have actually seen in the last month, as any feline practitioner will do, a couple cases of cats with cystitis. And that's a very common diagnostic category that cats might fall into. Most of you will be familiar. What's the cat with cystitis doing? Well, that means inflammation of the bladder. And that's the kitty who is probably going back and forth to the litter box, peeing little bits of urine. This is not a blocked cat, just a cat with inflammation. The urine might be bloody. The cat is probably licking themselves because they're a bit uncomfortable. There's little pee balls in the litter box. Well, one patient with these very common symptoms of cystitis was quite thirsty and was very grumpy and irritable. And her owner said she doesn't want to be brushed or petted. And she's spending all her time on a heating pad. We'll contrast this with another patient with the same common symptoms of the bloody urine and the frequent urination. However, this cat is completely thirstless, has parked herself over by the somewhat open window because she wants the cool air blowing in on her, and has also been quite clingy when the owner has been home. These two patients, although they have the same diagnosis, will, by principles of homeopathy, get different homeopathic medicines. In fact, when my colleagues call me, as they often do, Andrea, how do you treat cystitis? How do you treat cystitis so significantly, so effectively? I always say I don't treat cystitis. I treat cats who have cystitis-like symptoms as part of their mistunement. Sometimes that kind of goes over people's head, but it's not a cookbook. I'm looking at each individual patient. Let's move on to the next slide. So I just gave you two little small examples. Let's go to an old homeopathic case that was written up by a homeopathic physician, Dr. H.N. Guernsey. And many people don't know this, but there were many, many, many practicing homeopathic physicians all over the country. A significant percentage of practicing physicians were homeopaths. There were homeopathic hospitals, homeopathic mental hospitals. There was a whole homeopathic medical system that has often gone sort of forgotten. But Dr. Guernsey tells us, and these are his words, he says, a few years ago, whilst driving from house to house to visit my patients, I was detained at one place longer than usual when my coachman sent in to tell me that one of the horses was taken suddenly ill. Because bear in mind, 1880, driving means a horse-drawn carriage, and so probably this was a two-horse-drawn carriage that the doctor was doing his rounds on. So on going out to see what was the matter, the mare was lying flat on her belly and suffering with a severe attack of colic. Now, I'm a cat vet, but even I know enough that if a horse is lying flat on their belly with a severe attack of colic, that's a very sick horse. Let's go on to our next slide. Dr. Guernsey further describes the mare. He said she is of a mild and gentle disposition. She refused water, was thirstless, and she was covered with a cold sweat, although it was a warm summer day. He has his homeopathic observation glasses on, so he's looking at his patient, and he notes from the fact of her lying so flat upon the abdomen, I interpreted that she must have felt some relief from pressure, that her belly felt better from the pressure of laying upon it. He also noted her mild and gentle disposition, her lack of thirst, this cold sweat, and as the skilled, highly trained homeopath who knew how very important remedies presented, he immediately was able to recognize the picture of the homeopathic medicine pulsatilla. And he says pulsatilla 200C, that refers to a type of potency, was then and there given upon her tongue. And in less than half an hour, she rose, shook herself, and there was no more trouble, though I drove her to the stable and did not take her out again until the morning. And what I want to point out here, again, cat vet, but can still see the kind of amazing thing here. Not only did this very ill horse get up from a prone position from pain and was able to stand, but she also had to complete her work for the night. They hitched her back to the wagon, and she had to help drive the carriage back to the stable. And yet she was fine after a night's rest of that. I find that a very amazing and impressive story. Let's go on to our next slide. So we're going to talk a little bit more about Samuel Hahnemann. I could talk for a very long time about Hahnemann because he was a fascinating man, but I can't go on and on and on about him. He is really our founding father of homeopathy. He was German. He lived from 1755 to 1843. He was trained as a physician and a chemist, but really was just a broadly knowledgeable man. I think if we were to use some adjectives to describe him, he was brilliant, He was tenacious. He was extremely thoughtful. He was very logical. He was probably a bit of, he might have been viewed as stubborn or obstinate by people who met him because he was very unlikely to take anything at face value and always wanted to sort of figure things out for himself. Very, very logically minded. He was basically a great scientific mind. Um, Although he was, and he spoke 7 languages, which I almost forgot to mention. So he was trained as a physician, but when he went out to actually practice, he was very disenchanted because the methods of the time bothered him at 2 levels. One, he thought many of the methods were quite barbaric and damaging and injurious to the patients. Things like bloodletting, he couldn't get over that. And he was also quite taken aback by how much speculation and opinion reigned in what was deemed correct to do in medicine. That there was not real evidence behind things. People would not share information. Pharmacists would dispense concoctions of many different kinds of drugs, and nobody would know what was in them, but it was someone's opinion that they would work. And he found this so damaging to his conscience. He said, I can't do this anymore. So he quit the practice of medicine, but he did have to support his family. And so he became a translator of especially scientific texts where his many languages helped him out. Again, thinking about tenacious, it was said that he only slept every other night. So he could spend the other night, every other night he'd stay awake all night, working, translating. And one night he was working on translating a text. This was in 1789. And this text was discussing how Peruvian bark, also known as cinchona, was trying to explain why was this helpful for treating malaria. This is actually the bark from which quinine is extracted. Well, this text that Hahnemann was translating said, well, we explain this ability because it is very bitter. Cinchona is so bitter and astringent, this must be why it can treat the fevers, the recurrent fevers, the body aches, etc., that come with malaria. Well, logical Hahnemann said, well, wait a minute, this doesn't make sense to me. He said there are many other compounds that are as bitter or more bitter, and yet they cannot effectively treat malaria. His scientific and experimental mind said, I need to figure this out more. So what he decided to do was to make a tea of the cinchona bark and start dosing himself with it to see what would happen. And lo and behold, he began to develop many of the symptoms that resembled malaria: body aches, fevers, fatigue, etc. And his observation, his conclusion was quite different. He said, I think, here's my theory, and he's going to put it in the footnote to the translation. He said, I think this bark is curative because it can cause symptoms similar to those of the disease in the healthy, because he was healthy when he took this tea. So thereby it can cure these diseases in the ill. I think that's a fascinating thing that he figured out. This photo in this slide is near and dear to me. This is a statue to Hahnemann in Washington, D.C. that was erected in 1900 by the American Institute of Homeopathy, which is an organization that is still around. And they wanted to honor Hahnemann because of the helpful results of homeopathy in epidemic disease and just general health care in the United States. And it's interesting, this was the first monument in DC to a foreigner, because Hahnemann never visited America. It was the first foreigner honored with a monument other than some foreigners, especially some French, who helped in the American Revolution. And it's the only monument honoring a physician in Washington, D.C. Let's move on. So coming back to, Hahnemann's disenchantment with the sort of barbaric practices and the injurious nature of things, he really felt that true healing, a true return to health, should be gentle and kind. And because homeopathy respects and utilizes the body's innate ability to heal, it is just that. It is gentle and it is kind. And as we've talked about, we are looking to figure out how to help the patient by looking at their symptoms, the expressions of that individual patient, using that as a guide to our most similar remedy. And when we give that remedy, and if it acts curatively, the symptoms will essentially go away, often quite quickly, especially in an acute situation. And this is what a return to health should be. And in many cases, one treatment, and that means the use of one medicine, can restore the condition of health permanently. Hahnemann did have a very strong rule about only using one medicine at a time, because that was the way things were figured out, and he knew that that would be the most scientific way to assess the response of any patient to a medicine. And most importantly, when we are utilizing the body's innate ability to heal, what we have is that curative homeopathic treatment will result not just in the symptoms improving, but the patient as a whole will be in better health. And that's a wonderful thing, because for many years I would treat, I had treated so many patients with inflammatory bowel disease, and I could very easily make their vomiting go away almost like throwing a light switch by putting them on a corticosteroid anti-inflammatory like prednisolone. So yes, the vomiting would be better, but the patient as a whole would generally never be in improved health from that. I would just make a part of the patient better, never the whole of the patient. And then generally something worse would happen afterwards. So let's move on to the next slide. And so if we've got these basic principles of homeopathy, how do we apply these in veterinary homeopathy? Well, the principles of the theory are all exactly the same. It's just we're just extending this to all living things. And in veterinary homeopathy, we can treat many things: acute illness, infectious disease, injuries and trauma. Now, mind you, we may be giving a remedy. We're still, if a patient has a terrible open wound that needs to be sutured, we're still going to turn to that, or to set a broken bone, but we're going to bring in homeopathy to help support the whole patient. So it is compatible with certain aspects, certainly of first aid. We're also going to treat chronic disease, and that is, often the most challenging thing, and the thing that most frustrates veterinarians or other healthcare providers who have been trying to help their patients get better over time, but sort of get stuck with sort of never moving patients to a better plane of health. We can treat any species. There is not one set of remedies for animals and another set of remedies for humans. These are all applicable to small animals, pocket pets, exotics, wildlife, aquatic health, horses, livestock, herd health. Even plants can be treated with homeopathy. And the beauty of homeopathic medicines, these are in general quite inexpensive. There's no withdrawal times, and there's no chance of physical drug-like side effects, which is a wonderful thing. We can go to the next slide. So let's reiterate then. The homeopath's goal is to restore health. And we're going to do that by finding the remedy which produces the same symptoms in a healthy patient as the symptoms seen in our sick patient. And we're going to do this with one remedy at a time. And the exact right remedy is referred to as the simillimum. Where was the information derived from that built up the sort of library of information about remedies? Well, Hahnemann, again, was very, very scientific. He invented essentially what we now would consider drug testing. And he had a process that is referred to as provings, where healthy consenting adults would take small amounts of whatever substance that was safe to be taken in that fashion, could then be, and these people would record their symptoms, and Hahnemann amassed a vast trove of information about symptoms that these substances could cause. Now, he did not make people take poisonous substances, because in homeopathy we actually do use remedies derived from some substances that in a material form would be toxic, but in our diluted and energetically activated way no longer contain any toxic compounds. How do we know about what those things did? He looked in the historical documents, medical information about what happened when people were accidentally poisoned or exposed to toxic chemicals. So he gathered this information to build a collection of the symptoms that are represented by each remedy. And this was unheard of at that time. This is true science. And this is where, if you read the disparaging comments about homeopathy that refer to it as a pseudoscience, those are written by people who do not understand the scientific rigor with which this medical modality was established, to the degree that all these founding principles are still true today. And for fundamental principles to hold true over hundreds of years is, to me, expressing the scientific validity of what was found there. Whereas any of us who are in conventional medicine often know that whatever we were taught 10 or 20 or 30 years ago is often considered obsolete, that there's a shifting foundation, and yet conventional medicine is often thought of as more scientific. And I would argue otherwise. So, how do we find this correct remedy? Let's go to our next slide. Well, the homeopath looks at each case and does a case evaluation of each individual patient that they're going to see. And this is important to understand this. The first thing we do as a homeopath is to understand, are we looking at a patient with an acute or chronic disease? We're going to identify the symptoms as such. And this is very important because this part of your training, recognizing acute versus chronic disease, is one of the most important parts of our course, and one of the most important things to learn and understand to be a successful homeopathic practitioner. Not every program emphasizes this, because depending on what we are treating, it's going to influence our remedy selection, and also perhaps how frequently we may be repeating or redosing the remedy. When we are prescribing for acute illness, we are generally looking at what is most in front of us causing suffering, or I often use the phrase driving the train in the patient right at that moment. We're going to look at that patient in the here and now. We're going to prescribe for that patient. And especially in acute prescribing, acute veterinary prescribing is the best defense against anybody telling you that homeopathy works by placebo effect. Because what you will see, and we can refer back, say, to that colic case, some of these responses that we will see will seem almost biologically impossible. The rapidity with which a patient can improve, the rapidity with which wounds can almost close in front of your eyes, where pain can disappear within seconds of remedy pellets touching the patient's tongue. These are inarguably real things. Again, and in our veterinary patients with no possibility of a placebo effect. In chronic disease, there is a different approach. We do have to look not just at where the patient is now, but look more on the sort of life palette, the artist's palette of symptoms that have been expressed historically and currently. And in these patients, in most cases, we are going to not see some instantaneous return to health because most patients with chronic disease have been ill for a while. So we will generally see a slower, more gradual return to health, especially if there have been actual structural changes, tissue changes in the body, some of which will be able to heal more than you ever thought would be possible. But even when that process is something that may take months or even years to get the patient to the best state of health possible, throughout that journey, that healing journey, the patient will have an increased sense of well-being. There will be a return of just generally feeling more well, even if the disease has not been completely liberated from the organism. It's just a remarkable thing. We can go on to our next slide. Let's go a little bit deeper here, and let's dive a little bit deeper into what sort of acute illnesses, injuries, infectious disease might we see. In homeopathy, we don't use a time definition of acute and chronic the way conventional medicine does. Generally, if something has been only around for a certain amount of time, it's been considered acute, and then if it lingers, it's chronic. We're looking at things a little bit differently in homeopathy. In an acute illness, an acute disease, basically in homeopathy, we're looking at something that has some predictable endpoint, and that is that you're going to heal, recover, or not, perhaps die, but there is some endpoint to the process. And these things include trauma, shock, wounds, something like a corneal injury, post-operative analgesia. Any patient who has had surgery has to recover from an acute wound or injury that we've done to them. We hope for good reasons surgically. Post-operative analgesia is a remarkable example of, again, how it's not placebo effect. Sarah had lots of experience with watching patients who did not need any conventional drugs to recover in a better and more rapid way from, say, routine spays and neuters. Gastroenteritis, such a common presentation, dogs, cats, other animals, upper respiratory illness, colic. In all of these cases, what we will see is that we'll just see that the patient will get better faster. We can also have the great advantage if we have established clients who are under, their patients are under homeopathic care. We can have the additional advantage is if we have encourage the owners to have a home remedy kit of emergency remedies. We can often, with some basic questions over the phone, allow the client to get some treatment on board before we're arriving there in our mobile practice or before they're getting the patient into us. Again, extremely useful in something like a colic case. And it's very important in these acute injuries that we're not only, reducing pain and decreasing healing time, we are actually helping the body to fight infection in ways that are far more fundamental and effective than antibiotics. Because when we are engaging the vital force works through the physical body by employing the immune system as a tool. The vital force is guiding the immune system, strengthening the immune system when we strengthen the vital force. And it is the immune system that gets us better and heals us up in the physical part of things. I remember my mom's podiatrist, I didn't really like him very much, but I did like when he said to her, because my mom kept asking for antibiotics for this wound on her foot, he said, antibiotics don't heal wounds. Your body has to heal the wound. I didn't say to him, with the vital forces assistance, but it is the principle. We need to remember it is not the drugs we give, conventional drugs that we give patients that allow them to heal. It is their own bodies that are healing. And we as homeopaths allow the body to do that better when we're engaging its energetic driving force, the vital force. Next. And this is you, Sarah.
Right, so just to give you a brief explanation of how we teach this in the course. So, in order to bring to life the fundamentals of homeopathic theory and case taking, we start everyone with very simple acute cases so you can get those fundamentals rules down and understood. So, in the modules in our online program, 1 and 2, we teach you how to take a case, repertorize the case, study the materia medica, and learn to recognize remedies in their keynotes, which are often indicated in the treatment of acute problems. Now, for those of you that don't know what a keynote is a striking singular symptom that will often point you distinctly to a remedy. So many of you in the room have some homeopathic experience already and might know that arnica is excellent for trauma, or belladonna is a fantastic remedy in an emergency for heat stroke. But there are a wealth of keynotes to help you with your emergency and acute prescribing, as well as some more difficult acute cases, which we'll show you in some examples coming soon in the presentation. So as Andrea already mentioned, arnica for shock, trauma, and postoperative analgesia is a phenomenal remedy. We'll go deeply into postoperative analgesia and teach you all the remedies that are most commonly used. And as Andrea mentioned, this was one of the things that convinced me to become a homeopath. So on my way to vet school, I was primarily equine and I needed to get some small animal experience. And I was fortunate enough to become the head surgery tech and a holistic clinic in Portland, Oregon, who only used homeopathy to recover their patients from surgery. And there is nothing to convince you faster that homeopathy works and is not a placebo to watch animals recovering from surgery and immediately respond to a remedy given to control their pain and speed their healing. And the recovery time was so fast. It was faster than anything I'd experienced before in the university hospital I had worked at previously, or going on and having to be in allopathic clinics in veterinary school. Calendula is another fantastic emergency remedy that we use for stimulating wound healing and reducing scar tissue. It's phenomenal for wounds that need to heal by what's called second intention healing. So, those wounds that we can't surgically close and need to granulate in. It's wonderful to fight infection. And a nice little tip, it's really helpful for those naughty doggies that get too excited post surgery and pull their incision, and where you end up with a suture reaction that you think might start to become infected. Calendula is wonderful in those scenarios and will just settle that right down. We'll also go into a number of gastrointestinal remedies such as Nux vomica, Arsenicum album, Pulsatilla, Cinchona, and teach you how to repertorize and truly differentiate them based on what the patient is showing. Now, these are just a few examples. We obviously go into hundreds of remedies in the actual program. So when you learn how to work up the case and use a repertory and learn to create an analysis, we'll teach you how to select potencies and treatment schedules, and of course, utilize computer software that really helps streamline your case analysis and practice, because we all have busy practice schedules and models. So it's very important we teach you how to use technology to help you out. For those of you that don't know what the word repertory is, the repertory is a book where it's organized in order for parts of the body to organize symptoms, and then all those remedies that can be used for that symptom, such as the symptom for Andrea, as you discussed some cystitis cases, so you could have frequent urination. It could have a rubric, say, of 150 remedies. Those remedies would all be indicated for frequent urination. And so choosing symptoms that help represent your case, which I'll show you very shortly, will help streamline an analysis and help focus the remedies you need to study to match to your patient. All right, I'm going to pass back to you, Andrea.
Right. So touched on treatment of acute disease in veterinary medicine. So the more challenging uh, task, but the one that probably is the biggest part of day-to-day veterinary practice is dealing with patients with chronic disease. And chronic disease are diseases that do not have a predictable endpoint. In the human world, I guess not too many people watch TV with commercials anymore, but it used to be you could know the most common human chronic diseases is what are the commercials that you're seeing for? And it's all for asthma, for arthritis, for gastroesophageal reflux, for all the things, allergies, all the things that nobody ever gets better from. They just have to keep taking the prescription or non-prescription drugs that are being sold to them to help make their symptoms less. Well, in chronic disease and veterinary medicine, there's some of the same things. Allergies are a huge thing, often in dogs manifested by what many people call ear infections, but are probably more correctly called ear inflammations. In the cat world, the feline lower urinary tract disease, cystitis. In both species, many species, intervertebral disc disease, degenerative joint disease, osteoarthritis. This is all chronic disease. All immune-mediated diseases are chronic disease. The anemias, fevers, the painful masticatory myositis, which can affect dogs' musculature on their heads. Diabetes, seizures, all of these things. In my cat world, I live in the world of inflammatory bowel disease as an incredibly prevalent, common named condition in cats. Malabsorption, other GI disease. And of course, cancer. Cancer is just actually a chronic disease. We could approach these conditions with hope in homeopathy. We're taught that these are, for the most part, incurable, but many of these patients can be restored to a level of health that you never would have thought possible, sometimes even to full return of health. And when you're doing that with homeopathy, you're not chasing the side effects that you would when you're dealing with allopathic medicine. Now, Honestly, of course, we have to acknowledge there are patients that are incurable. There are patients whose disease may be so advanced, especially advanced cancer patients, where perhaps you are not going to be able to cure them. But with proper prescribing, you can give those patients a quality of life for the time they have that is unsurpassed by any other form of medicine. But this does require a sort of a different approach than dealing with acute disease. So it really, if you look, most veterinarians, when they look at that list, would just want to put their head in their hands about what they can actually fix. Um, I approach these patients now with hope versus just, oh boy, how many drugs am I going to have to give you and what bad things are going to happen from that. You can go to the next slide. Um, in treating patients with chronic disease, in our program, we're going to learn remedies that are most indicated for chronic disease. This was something that Hahnemann has done the trial and error work of figuring out for us, that some remedies could get patients better for acute things, but would not hold them into longer term health. He figured out that there are different types of remedies with a different scope or depth of action to be able to actually reach in and help the body heal from more chronic situations. We will teach you to have a case strategy and decide on how to interpret the response to a given prescription. And this is very important because when we're giving a remedy, especially in chronic disease, it is the patient's response that helps us understand, was the response curative or non-curative? This is very important in homeopathy. And we really emphasize this in the program. We will also try to help you understand that you're going to get chronic cases at different stages of things. Unless you are someone whose practice has been long established, what you're often going to get is a homeopath. People with chronic disease bring their animals, or excuse me, people whose animals have chronic disease are often using homeopathy as a last resort, and understanding how to take on a case that has been shifted, affected, sort of had layers of confusion added upon it by sometimes years of conventional treatment. These require a particular kind of strategy and patience and knowledge to deal with correctly. And this is why casework is such a big part of our program, and why our program is long enough that students will have time to follow up cases over time so that we can help them understand the trajectory of a patient under homeopathic care. And again, in all of these patients, we are doing the principles of case analysis, really teaching you how to take a case, how to get the most valuable symptoms, sort of as a portrait of your patient, correlating that with the best remedy, understanding responses, and really understanding that that's the key to correcting the imbalance of the vital force that is chronic disease. Sarah?
All right, so just to let you know how we work chronic disease into our educational program. So we start in module 2, and then we build throughout module 3, 4, and 5 with the complexity of chronic disease as the students enhance their skills in case taking and prescribing. The same is also true of acute disease, where we start with simple acute casework in modules 1 and 2, and then as the course progresses and everyone's prescribing skills progress, we uh, continue to work with the more critical acute cases, and we build in that severity of disease. So by the end of the course, people are comfortable treating crises and emergencies and life-threatening conditions. So In order to learn how to treat chronic disease, we need to teach you to learn to recognize all the symptoms in a patient as an expression of the chronic disease. And that remedy selection will be based on symptoms, as Andrea said, throughout the patient's lifetime. So when you receive that big stack of medical history and you go through their history with the client, you'll need to be able to understand how to ferret out of all those symptoms what are most characteristic of that patient. And it's a really important foundation principle of classical homeopathy that say you have a patient that has a history of ear discharges, cystitis, vomiting, a ruptured cranial cruciate ligament, all in the same patient, that patient is receiving one homeopathic remedy to address their susceptibility to those chronic disease symptoms. And we expect in a curative case that the patient will not only have that return of well being, but their symptoms will diminish or resolve. When you have cases of fixed pathology, such as a joint that has been destroyed, you have improved functionality and a return to health and mobility. And those patients go on to then become healthier, more resistant to acute infections, and don't go on and form deeper forms of chronic disease. And again, we teach you to optimize and utilize computer software and reference material to streamline and guide your prescription selection so that when you're in your busy practice, you can actually do this quite quickly. So,
Okay.
Andrea, I'm going to go to
Yeah.
you.
So, in summary, um, effective homeopathic prescribing in chronic disease restores health with a single remedy to treat multiple symptoms. Now, I'm going to give you a little dose of reality and say that it is often the case with a patient with chronic illness that it's not just one remedy, it is a series of remedies over time, but only one at a time. It is the case in many patients with chronic disease that it is not possible, even for a skilled homeopath, to exactly determine the exact right remedy. And so we will use a series of very good or close matches that also will move the patient gradually towards health. And requires some patience and skill, but and the whole nature of it, really the most important thing is understanding and how to recognize, is the patient's response one of cure, or is the patient's response a non-curative response? These are the responses we refer to as palliation or suppression. And palliation and suppression is what we are used to doing in conventional medicine, where palliation is, yeah, we can make something get better, but we have to keep doing it to keep it in that state. And suppression is when we can make a symptom better, but it's at the expense of the patient then going on to develop a worse disease or condition later on, which in conventional medicine is generally viewed as a separate event. But as homeopaths, we view a patient's entire health trajectory as one related path. We don't break the patient up into sort of increments of time. Um, and all in all, basically, our goal is the highest plane of health possible for the individual. And probably where one will see this shine the most is if you have the opportunity to work with young animals, which I've felt very fortunate. Now I've been doing this long enough that many of my clients who came to me with aged, ill cats with chronic disease that I could help to a certain degree, but perhaps not fully cure and resolve everything. When those old patients have passed away and folks bring me a new kitten, and I work with the young before they have been mistuned and affected by other things, the vibrancy and the health that can go with these patients is remarkable. I keep having clients who just look at me and say, how come my cat never vomits? And I'm like, because cats aren't supposed to vomit. Um, Sarah, you have an example of lifespan differences in the dogs you work with.
Yes. So I think it's been really interesting.
For example, small dogs tend to live
Hang on
much
a
longer than
second.
larger dogs.
I think that was your Siri getting involved. All right. So, what has been quite interesting now that I've been in my own homeopathic practice for over a decade and a half, that you start to see the difference in patients' lifespans. So, I tell my clients that I expect my Labradors to live between 16 to 18 years old with good homeopathic treatments and good diet, nutrition, and care. And so you start seeing these differences in health of what we thought was normal is actually ill health, and what is the possibility to achieve when you actually treat patients with homeopathy and can start with them young enough. And the real importance for those of you considering taking a veterinary course versus a human course is that in our veterinary program, we need to teach you how to work with the nonverbal patient. So when Andreas said, sometimes you can't see the simillimum right away in a patient with chronic disease, and you need to start with a very close prescription and work your way there, it's because our patients can't talk to us. And so we teach you how to work with the nonverbal patient, how to identify what's most characteristic when they can't talk to you, and then how to evaluate the remedy reaction so that you can work your way towards finding the simillimum as you uncover more and more information about the patient. We also teach you how to work with the repertory and the materia medica that have been evolved for humans. It's the one form of medicine that was completely tested on humans and now applied to animals instead of the other way around. And so we teach you how to work within the human repertory and materia medica to adapt for animal body parts that humans don't have or animal conditions that humans don't have. And we teach you how to use the language so you can figure it out. So that's a really important difference between veterinary and human programs. So, Andre, are you ready for us to move on?
Yep. So, lastly, before we take a break, I'm just going to say, so why add homeopathy to your practice? Well, there is the simplicity and the elegance and the user friendliness of one medicine, one homeopathic remedy per patient at a time, extremely cat friendly. I know everybody loves to pill cats based on all the online memes I've seen for things like that. We are promoting healing instead of suppressing symptoms of illness. As we've said over and over again, no undesirable drug side effects. We can have, even in patients with advanced pathology, often a very rapid return of patient's well-being. I'm seeing that in a patient. I'm not sure whether the patient's going to make it or not, but when I gave a remedy, when this patient was discharged from the ICU, within 5 minutes, I watched a profoundly ill cat just obviously feel better. Still up against a lot of health challenges that we're working through, but it was remarkable watching the patient's demeanor change, and he just simply felt better. Remedies are inexpensive to stock and prescribe, and the same remedy can be used across species. So, as I said, one pharmacy fits all from fish to people.
All right. It's halfway point. Before we go into our case presentations, it's time for everyone to take a break. So we're going to go ahead and take a 10-minute break right now. So if everyone can come back at approximately 20 after the hour. All right, we'll see you guys very shortly. Welcome back, everyone. I hope you've been enjoying the talk tonight. So that concludes the theory and principles section of our presentation. And now we're going to go into some exciting case presentations to bring it to life for you so you can see homeopathic medicine in action. So for each case presentation in this introductory webinar that we're doing, we're going to briefly demonstrate homeopathic symptom selection, case analysis, prescription selection, remedy dosage choice, which includes frequency of repetition and potency selection, and then follow-up monitoring. So let's begin with our first case. This is a case of a European collared dove. Now, this was a near drowning episode, so it's a nice wildlife emergency case, and I'm sure many of you in the room do wildlife emergency work. So this was July 14th, 2022. This was a dove fledgling in her first 48 hours of learning to fly out of the nest in the stables. So this was on my property. We were in the process of building a large barn, and we had some temporary wooden stables set up. And we had European collared doves nesting in the stables up on the ceiling beams, which were quite low. And I was quite excited because I had watched them through their whole courtship and nesting process and got to hear the chicks hatch and watch them grow. And so I knew exactly when they started flying. And they had been testing their wings and taking off and doing crash landings into the stable walls. And as you all know, fledglings are all a bit awkward when they start learning how to fly. And so what they were doing is between the ceiling beams and the ledges, as you can see in this photo, you can see there's ledges running around all sides of the stable. So they were taking off, having a little flight, and then crashing landing. And so that day, I had been out in the stable yard early in the morning and in the afternoon, and a quick check in the early evening. And my last check was probably around 6 p.m. It was definitely during daylight and well before roosting hours. And so I got kept late out with work. And as I said, I do run a 24-hour practice. And when I got back, I'd gone out to the stables, and it was just after midnight. And I found this beautiful little dove fledgling that I had just taken these photos earlier that day, stuck in the water trough in the barn, presumably bounced in after a bad landing. So, as you can see, the stable ledges run all around the walls of the stable, and in one corner, there happened to be a water trough for each, well, the free horse, so they could have free choice drinking. So, I presume she had a crash landing in the wall, fell in, and then just couldn't get out. So she was just about keeping her head above the water, on the verge of giving up. Her wings were completely outstretched, staying afloat. Her whole body was soaked, and she just had no strength left. She was unable to move and unresponsive. So I immediately scooped her up. She was weak, shivering, and hypothermic, and I obviously had no idea how long she had been there. So I bundled her under my coat and I rushed her inside the house, and I wrapped her little soaked bird body in a birdie towel burrito. And with my homeopathic emergency knowledge of keynote prescribing, I rushed to my emergency kit and selected aconite 10M. Now, a 10M potency is a very high potency, and it's much higher than what you get over the counter. But we'll teach you how to use the higher potencies, which are brilliant in emergency scenarios because you get these lightning fast responses. So I mixed up the remedy in water, and I used a syringe to just dribble a little bit of the solution over her beak and just slightly into her nair to make sure it got mucous membrane contact. And then after I dosed her, I immediately started warming a hot water bottle, and then I rewrapped her in a fresh, dry towel burrito. Now her response was lightning fast. She visibly relaxed seconds post aconite. Now, this is very common in emergencies. This is what I expect to see when I give the right remedy. I want to see a very fast response. She stopped shivering before the hot water bottle was applied. And so I let her settle as she seemed so weak. And this is really important for anybody that does wildlife work. We know how sensitive wild creatures are because they're not used to human contact or any kind of handling. So you have to be careful and take sort of a hands-off approach to not frighten them. But I could tell she just seemed to, at that point, be grateful to not be fighting for her life anymore. So her body temperature was slowly rising, but she wasn't reacting to any of her body temperature checks. Now, again, taking sort of a hands-off approach, what I was doing was just sticking my finger under her wing inside the towel to just check to see how warm she was, trying to be minimally invasive because I have a shocky bird. And as we all know, birds can very easily in this type of scenario go into cardiac arrest. So here she is. This is a photo of her within 5 minutes post aconite. And you can see 5 minutes after the remedy, She's relaxed, she's shut her eyes, and she's just resting, and she's taking a moment to recover. So I can visibly see that I have a response happening. Now, you may ask, why did I select aconite? Aconite is strongly indicated for very sudden, violent, acute illnesses, and it has keynote causations of shock, fright, and distinctly the causation for taking cold. And I definitely had someone that was stuck in cold water for hours upon end. So at this point, she had a bit of life back, but as you saw in that photo, she was still so weak and cold and she wasn't reacting to her temperature checks. And I would have expected her at that point to do so. So perhaps in a dog or cat, I might have gone for a slightly shorter response interval. But again, dealing with wildlife, we need to give them a bit of space and time so we don't overwhelm them. After about 30 minutes, I felt that she wasn't progressing further, and so I repeated the aconite 10M. And within 5 to 10 minutes, it was like a switch was flipped, and she started reacting to me checking her body temperature. And by having her little beak start furiously pecking my finger and telling me to step off. And as you can see from this photo, taken about 5 to 10 minutes after the remedy, she's giving me that hard bird stare, telling me, I'm not sure I should trust you, human. And that's exactly what I want to see because that is a normal response from a wild bird. So I left her to snooze and backed off at this point. She continued to improve, and I placed her in a bird-friendly cat carrier with a refreshed hot water bottle and her towel wrap for the night with amenities to recoup. So here are her photos. You can see she was so weak and exhausted. I just had her wrapped in a towel on my kitchen chair initially. And then here in the second photo to the right, you can see I have her placed in her cat carrier with her amenities for the night. So I did continue to observe her for several hours because, once someone comes into my care, I want to make sure she was stable, that she was going to make it and survive. But at some point at 4 a.m., I decided it was time I get a little bit of sleep. So at 5 hours later, it's about 9 a.m., I came to check on her and she was bright as a button, as you can see in this photo. And please excuse the glare of the cat carrier looking through the door. But as you can see, she's very bright, alert, and chipper and giving me the hard bird stare, telling me it's time to let me outside. As you can see, she still has quite a bit of preening to do to get her tail feathers back in order. So at this point, I left her in a quiet room and said, let's give you a little bit more time and then I'll release you about midday when I know you'll be safe. So I took her out at 13:18 that day, released her back into her stable right near her nest and the ceiling rafters above. She immediately flew up to the ceiling and crashed into landing into a beam where she then rested for a few hours. She then began testing her flight between the stable beams, and about 3 hours later, my spouse observed that she fully rejoined her parents, and we saw her get a crop feed. And I was able, because I was obviously living in and out with her every day, to observe her for several more weeks till she was fully mature and she made a full recovery. And here she is about 4 days later on the fence line with her sibling, getting ready to receive a crop feed. And then here they are post lunch, having a nice little rest, looking nearly full adult like and ready to fully flee the nest. So, this is just a nice example of emergency prescribing with one remedy, 2 doses, and I didn't need to think about what's the license of this medication for this species. Homeopathic medicines, it's the same medicine for all species, which is wonderful for your pharmacy costs. So our second case is another acute case, another emergency. So this is a case of colic in a horse. Now, Andrea discussed the historical case of colic, so this is a real case from my practice in North Yorkshire, England. This is May 27th, 2014. This is Penny. She's a 25-year-old, very sweet Shetland mare. She had been a patient of mine for a number of years. She had no previous history of colic, and her owner was a very experienced horsewoman who I think she just took leave of her senses that day because, for all of her experience, she made a terrible equine decision of turning her 25-year-old Shetland pony out on a new lush grass field that hadn't been grazed off by sheep or anyone else. And unsurprisingly, she brought her in that evening showing signs of colic, a bloating caudal abdomen. She wasn't passing manure. She was refusing to eat and she was acting painful. Now, this client was a bit of a panicker, and I lived over an hour away from her. And obviously, I live rurally, so my practice space can be quite wide. So even though I lived an hour from this client, within that practice radius, I could be up to 2 hours away. So she called the closest emergency practice before calling me, and they diagnosed gas colic and administered an IV injection of Banamine, which is fluoxetine meglumine, at 7:45 p.m. So at 9 p.m., so this is an hour and 15 minutes later, she contacted me, her primary care practitioner, and told me that Penny wasn't showing any signs of improvement. She was still painful. She wouldn't eat. And at this point, because I live in the UK and the Royal College of Veterinary Surgeons has certain practice laws about not interfering with another veterinary surgeon's treatment, I told her because she didn't call me first, we needed to let the treatment from the prior veterinary surgeon complete its action before I could engage. So I told her she had to wait 2 hours from the onset of action of Banamine. Unless Penny showed any signs of worsening, she had to contact me immediately. Now, at this point, I'm well over an hour away from this client. I was quite a distance away. So I was working my way back and obviously had my phone on me for any emergency call. So the client phoned me promptly at 9:45 p.m. without a second delay, reporting that there was absolutely no change. So her current symptoms at 9:45 p.m., she had distension of her caudal abdomen. Her abdomen was painful upon being touched, and she was trying to bite the client. Now, this was extremely unusual for Penny because Penny was such a sweet Shetland mare. And while she could be feisty when she was well, she was always very kind and cuddly with her mom. And so for Penny to try to bite, that was highly unusual and showed us the degree of discomfort she was in. The client also observed her to be burping 3 times in the last 2.5 hours. Now, she did not tell me this earlier because had she told me she was burping earlier, I would have immediately rerouted and started prescribing. Because for those of you that aren't equine vets, horses are not designed to burp. They don't normally burp. And if you see burping in a colic episode, it usually indicates a sign of obstruction and is a very negative prognosis. So now I'm extremely concerned and I have already rerouted to head towards her. Penny had still not passed any manure. So I pull over on the side of the road to do a very quick homeopathic analysis to help me choose my remedy. And so what you're looking at here, this is a snapshot of a homeopathic analysis. So what you're seeing over here on the left, you're seeing 4 symptoms that I selected. So these are called rubrics. So remember I discussed before, repertory is a book full of symptoms. We call them rubric groupings. And so we have a symptom of abdomen colic, which contains 104 remedies that are indicated for colic. Our next symptom is eructation or burping. Eructations are the old-fashioned word for burping. And again, that's 117 remedies that are indicated for eructations. I also used abdomen distensive pain and abdomen aggravation from touch because she was trying to bite when her abdomen was being touched. But she wasn't trying to bite the client when the client was touching her head or her neck. So I selected these 4 symptoms as my most characteristic symptoms. And as you can see, it brings up remedies and shows the highest grade for those remedies that are most strongly indicated for that condition. Now, this is just a computer software. It's just designed as a tool to help bring up remedies for you to study. It does not mean you choose the #1 remedy in your analysis, because I always tell our students a computer is not a brain, and it is only as good as the information that you've put into it. So on reviewing the remedies, you can see that came up here. We have belladonna, china, calicarb, aconite, arsenicum, ipecac. And normally in an acute scenario, with well-selected rubrics, we're telling our students to study the top 10 remedies. Now, in this case, I knew from all my prior experience that belladonna has this really strong indication for aggravation from touch. It is a major gas colic remedy. It's got loads of symptoms in the Materia Medica about gas colic. For those of you that have done some basic prescribing courses, you probably know belladonna more for fevers or for heat stroke, but belladonna has a very wide range of symptoms for acute disease. It's a major colic remedy, and it's on my top 3 colic remedies that I use in my practice. So Penny trying to bite when her abdomen was touched was such a strong keynote in this case because it was such an extreme change from her normal sweet disposition. I knew I had to find a remedy that had that symptom. So I selected Belladonna 1M, which I knew the client had in her emergency kit. Because she had a small holding, she had lots of animals, I made sure she had quite a large emergency kit, especially because she was an hour away from me. So at 10 p.m., she received her first dose, and now I stayed on the phone with the client as then I continued to drive towards her farm. In her response, she observed Penny begin to relax within the first 5 minutes of the remedy. And within 15 minutes post remedy, she passed a pile of manure, which said to me, this pony that hadn't passed a pile of manure in hours. And now horses, they tend to pass a pile of manure about every 2 hours or so, or quite regularly. So the fact that she hadn't passed in hours and now she passed a pile of manure says that her gastrointestinal tract is starting to work again. So things are moving, which is what we want. And more importantly here, she started eating. A happy horse is an eating horse. Horses are designed to eat 24/7. And so when they're refusing to eat, we know we have a problem. And then what was really interesting is her abdomen just gradually and gradually looked less bloated over the next 2 hours. So now the client and I had scheduled phone checks after I was secure that she was on her way to recovery and she had passed the manure and started eating again. So I had her call me every 15 minutes till we knew everything was okay. And she was monitored throughout the night, but she completely returned to normal. No further medication or doses were needed. And what's so lovely about this case is it just gives you a really nice, sweet example of how I expect my colic cases to respond in practice. All my horse clients have emergency kits at home because I live rurally, like most equine vets, and most people are of a distance from my house where, it might take me 45 minutes to an hour to get to them. And in that time, I can tell them to start prescribing. And more often than not, they are resolved before I ever get to their property. So this is how I expect my colics to respond. And this is, to me, shows the beauty of emergency prescribing. All right, so we're going to move to our third case. So this is a case of a cat with a ruptured globe. Now, this is quite an impressive case. This is from one of our graduates, Sharon Forrester Berlin. She lives and practices in Corvallis, Oregon. She was a 2017-2018 professional course graduate. And Sharon, in all her free time, because she owns her own practice, she takes part in a community outreach service as their volunteer vet. And this day, she received an ophthalmological consult request via text that was very dire. And she was told that one of our homeless community had brought in her intact male cat, Stormy Weather, who had an eye problem of a long duration. So this is the history she's given. So Sharon found out when she showed up to examine this cat that it was actually a ruptured globe, probably from a fight with another cat. And so in this limited situation where there's no funds, no ability to hospitalize the cat, she did recall that in module 1 of our course, we talked about the remedy symphytum being the arnica of the eye. Now, many of you from your herbalism studies will know symphytum as comfrey or bone set, and it's very prominent remedies for fractures. But the homeopathic remedy symphytum also has this strong affinity for trauma to the eye. So Sharon prescribed for stormy weather a single dose of symphytum 1M. And then she said he ran away to court females. And so she had no ability to examine him until the next clinic that was part of the community outreach, where his owner brought him in his cage, arriving on the back of her bike. And she said it was a remarkable recovery. So I'm about to show you the photos. So here we are with our traumatic ruptured globe before treatment on examination by Sharon. And you can see we have a lovely, perfect laceration of the globe with marked chemosis or very swollen edematous conjunctiva. And so we can tell that this is a very angry and inflamed eye. And in conventional or allopathic medicine, the best we would hope to do in this case is to calm the inflammation down, give the patient a bit of pain control, and then schedule an enucleation surgery, which is surgery to remove the eye. So here's the photo from 10 days later, presenting back to the clinic. Here's stormy weather. This is a profound case, even for those of us that have been in homeopathic practice for decades. Seeing a patient with not necessarily our preferred management, no comfort drops, no monitoring, just a single dose of a remedy, we actually have a completely healed globe. The eye is probably not visual, but we have a patient with a happy eye, with a very minor scar, and he gets to keep his eye. Andrea, do you have anything to add to this case, given all your years in feline practice?
Well, to me, it reminds me of the sort of sad story of somebody's little girl's goldfish dying, and then they go out and they buy another goldfish and put it in the bowl, and so maybe nobody would know the difference. My first instinct is like, that's not even the same cat. So that's how profound it is to me. Of course, it is the same cat. And this is what, when we engage the body in every way, shape, and form possible, physically and energetically, wow, look at that. Healing better than you could ever expect.
Yes, and you could even see the scarring from the upper lid from his
Yeah.
prior injuries as well. So this is just a very nice, profound emergency case. Our next case is delving back into the equine world. This is a nice example of treating infectious disease with homeopathy. So this case was seen on August 4th, 2012. Our patient was Marmite, a 2-year-old filly. She's a standardbred cross French trotter. For those of you in Australia, she should have been called Vegemite. So Marmite is a salty topical spread that is loved or hated by many citizens of the UK. So the client was a horse breeding dealing facility, and we did know there were strangles endemic on the property with recurrent outbreaks. And once you get strangles endemic on the property, because it can live in the soil, it's really hard to get rid of. So it's very common for new horses that would come onto the property to have an outbreak of an infection, for those of you not in the equine world. So on exam, I found that she had severe acute submandibular lymph node swelling, which is what we expect in strangles, but it was severely worse on the left side. And the soft tissue swelling underneath the left mandible was so severe, it just went up all the way to the left cheek and the throat latch region. And to this day, this is the most severe strangle case that I've seen with muscular involvement, because it was just going up the whole side of the face and into the neck. She, of course, was feeling very lethargic, had the classic malaise, I don't feel well, decreased appetite. And because it was known that strangles was endemic on the property, the client declined any kind of further diagnostics. So I worked up the case and prescribed calcareous a Calcarea carbonica 10M, and a single dose. Now, many of you are not used to seeing Calcarea used in acute scenarios, but it is what we call a polycrest, a very commonly used remedy in homeopathic medicine because it has such a broad breadth of symptoms. And I selected Calcarea out of all the remedies indicated for that kind of lymph node abscess because it has this specific affinity for glandular swelling below the jaw and the neck. And most importantly, abscesses deep in the muscles. Because, like I said, I had never seen such profound muscular involvement in strangles. It also is known for painful swelling and separation of the submandibular glands. So Marmite's response, within 24 hours, she became much brighter in herself. She had a return interest in feed, and swelling was reduced around the cheek and the throat latch region. So remember how Andrea said the first thing you should always see in treatment is that return of well-being? This is exactly what I wanted to see. I needed to see something happen within that first 12 to 24-hour period. And at 48 hours, the abscess ruptured, the swelling reduced further, and she had a complete return to normal behavior. And unfortunately, this was at the age where not all of us had photo phones in our pockets. So unfortunately, I didn't have my camera on the day that I went to see her, but I did have my camera on the day that I went to recheck and 48 hours later. So here we are. This photo is showing you it's positioned under the jaw. So I'm looking up under the jaw, and this is the left side of her mandible, and this is the ruptured strangles abscess. So her response continued, and that draining abscess and all further associated swelling just slowly resolved between 4 to 7 days post prescription, depending on which element you were discussing. And no further treatment was needed. So again, here was a single dose to treat a very severe abscess in a sick horse. And for those of you that are used to treating strangles, we don't normally see them respond this fast. So this is what I love about homeopathy. Again, you see things that vet school taught you that couldn't happen that biologically fast. So you see things respond in such a quicker rate than what you would normally expect. So this is a photo of Marmite when she was recovered, and you can see she was a very lanky 2-year-old in her growth phases. Okay, so our last case we're going to go into, this is a case of chronic disease to give you a taste of what treating chronic disease looks like. And this is a case of behavioral issues and a malocclusion. So Taz was a 4-year-old neutered male border collie, and he was from a working line. Now, in the UK, especially in Yorkshire, we have a lot of sheep and we have a strong breeding. Basically, we have a lot of working collies and they are used for actual work. And so our working lines you can see those behavior atypathies that come out of those working lines because they are bred to have that hyper focus. So Taz was regulated not for work, but to a pet home because he was observed to have problematic behavior from a very, very early age. So when they called me out to see him, they summarized it as just generally problematic. He was fearful, he was anxious, he was noise sensitive, he was fear aggressive, you named it, he had it. And the only physical symptom this dog had, he had a perfect coat, he had no history of ear discharges, eye discharges, no gastrointestinal complaints, poop's always perfect. There was nothing else except he had a class 2 malocclusion, mandibular disocclusion, which simply means that he had a significant overbite or overshot jaw, giving like a shark-like appearance. And the mandible, so his lower jaw, was displaced caudally by over 2 centimeters. He was so nervous, I couldn't get an accurate measurement at the time. But as you can see from this photo of him, he's adorable, and he has his tongue protruding 100% of the time to varying degrees because of this malocclusion in his jaw. So let me tell you a little bit more about his behavior so you can appreciate it. So at 4 to 5 weeks of age, he was observed by the breeder to start having he was first observed at 4 to 5 weeks of age by the breeder to have this behavioral issues. And despite extensive training and behavioral modification, his symptoms were little modified by 4 years of age. Now, he ended up with these particular clients because this breeder knew that they had had working dogs from them before. They were highly experienced individuals used to dealing with behavior cases. And so she pleaded with them to take Taz because she didn't know where else he would go. So Taz was wary of people. He was fear aggressive with strangers approaching on the street, entering the home. He can run and hide from strangers. He was hypersensitive, hyperreactive. When he was stressed, he would urinate when stroked. He would panic with any kind of raised voices or shouting. And this was a dog that had received no abuse. This dog came from a good breeder. He had an excellent start in life. He went into a very good home. This was just Taz. This is how he was since he was 4 to 5 weeks of age. He would show displacement activity when he was very stressed by chewing his front legs, and his front legs had excessive saliva staining on them that you could see from all of that displacement activity. What was really interesting about Taz is, especially because his behavior started at such a young age, he was never interested in playing with other dogs. He'd never exhibited any normal playful behavior, whether they were new dogs or the 3 other dogs that he lived with. And his clients had never seen a dog not play to this degree that as Taz did. So I'm just going to show you some example homeopathic analysis to show how one might approach this case. So even though I gave you this laundry list of behavior, we have to simplify it because we can't ask the patient what he's thinking. So the first analysis that I'm showing you, I'm boiling down the case to the 2 most primary dysfunctions. So we have the behavioral symptom of this fear, and there's this nice rubric from the Boger Bonninghausen repertory: mind, fearsome, anxiety, dread, frightened easily, etc. It kind of universally encapsulates what he is feeling. And then our other primary symptom is arrested development. So this dog not only has his jaw not developed properly, but he's showing these behavioral symptoms from an extremely young age. Now, at 4 to 5 weeks of age, that's a crucial period of development. And Taz should have been learning at that point what was safe in his world and what wasn't. So, for example, when a puppy hears a door slam, like a loud noise, such as a door slam or someone shout, and nothing bad happens to them, they should learn that then they don't need to be afraid of that sound. Well, Taz wasn't making any of those learning connections. And this is a common theme for dogs with noise sensitivity. For most dogs with noise sensitivity, it's actually a portion of arrested development, the ones that have always been noise sensitive since they were puppies. They've not reconciled in their mind of what's safe and what's not safe. So this combined rubric I'm using here describes dwarfishness, meaning just arrested development. That's an old-fashioned word through Kent, not necessarily meaning someone of a small stature, but just any arrested development of a body part or the mind. Arrested development in general, and growth affected. The second analysis, I just simply use the rubric for dwarfishness. So again, arrested development, mind starting startled, mind sensitive oversensitive, and mind fear. And I'm getting pretty similar remedies in both analysis. I'm getting Burrita carbonica, calcarea, which we used in Marmite. Now we're using it in a chronic case, phosphorus, sulfur, natrium muriaticum, etc. In our second analysis, similar remedies, just in a different order: sulfur, Burrita carbonica, calcarea, lycopodium, carboveg, silica, etc. So what we're showing you as part of what we teach you in the course is how to assess your cases to boil down to what are the most characteristic symptoms, What are the ways I can describe this using the human repertory? And then what are the different types of analysis I can do to see if I'm getting the similar remedies come up so I can study them further in the materia medica to select the exact right remedy for this patient. So I selected Borgreata carbonica 1M to give to Taz. So why did I pick Burrito carbonica of all the other fantastic developmental remedies such as silica, calcarb, natmur, sulfur, etc.? Burrito carbonica has such striking symptoms of a lack of mental physical development from a very early age, a frozen maturation process. These patients have a lot of fear and hiding behavior. They're easily frightened and they're afraid of strangers. They're cowardly. And then I loved the sentence in the Materia Medica, sudden ebullitions of anger, but coupled with cowardice. I think that is such a beautiful description of fear aggression in dogs, where they have this surge of anger, but it's coming from this place of they're so deeply afraid. They just need to protect themselves. Burrito carbonica also shows extreme oversensitiveness of all senses and an oversensitive to noise and voices. And that characteristic symptom, that weird symptom, you have a collie that has never wanted to play. The Burrito carbonica child does not want to play. So I felt fairly confident in my prescription that this was a great opening remedy to start this case. So we got his first dose on January 30th, 2014. And his remedy response. So in most cases of chronic disease, you're giving a remedy and you're giving the patient time to respond. And the duration of time you give them to respond depends on the severity of the case. You might be giving someone a few days in a cancer case versus a few weeks or a few months, depending on the type of situation, how fast you would expect change to occur. So in Taz's case, I was following up with the monthly, but I expected we would need to give, in most behavioral cases, I know I need to give them a minimum of 6 to 8 weeks to not just give the remedy time to work and the patient to respond, but time for that patient to go into the world, have scenarios happen that would previously trigger them and learn new responses because you've dropped their anger levels or their anxiety levels, their reactivity levels. So you have to give them time to learn that the world's not so scary anymore. So just to go over his physical symptom progression, what we observed is initially after the remedy, the clients noticed him scratching the bridge of his muzzle. They originally described it, they said, oh, he's rubbing his eyes a lot. And I said, well, can you show me what you mean by rubbing his eyes? This is a dog that has 0 eye symptoms. And when they actually showed me, they were just showing me the dog taking his paws up and rubbing the whole bridge of his muzzle and down. He was also excessively drooling and eating slowly for several weeks. And then again, he had another phase of rubbing the bridge of his muzzle, drooling and eating slowly after about 3 months. This was this dog showing growing pains. So by 2.5 months post-remedy, there was only a very slight overbite remaining. And at 4.5 months post-remedy, after that second bout of sensation he was feeling, the overbite completely corrected. It was 100% resolved. Now, I just want to remind you, this is a 4-year-old dog. 4 years old. I was taught in vet school that his growth plates everywhere should have completely fused by 2 years of age. This was physiologically impossible according to my scientific training. In this case, I remember at the time, I felt like my brain had just exploded with the possibility of learning that homeopathy literally can unlock the DNA potential of that patient. It can literally unlock the genetic code and allow them to achieve their full potential. So, regarding his behavior, within a few weeks of the prescription, he showed a general increased confidence with people, raised voices, etc. That response just continued to develop and explode. He started playing with the other dogs. I was so joyful when I heard that, made my day. He became so confident. We actually then were struggling with a hierarchy shift in the pack because then he decided he should be in charge and was challenging the top dog because he lived in a home with three other dogs. He then was coping with the world. And at this point, they tell me, oh, yeah, and he's being so well behaved on the bus. And I was like, you've been taking him on the bus? So this is a fear aggressive dog that these clients have been taking on a big bus, not double decker buses, but a single level bus to get around town because they lived on the outskirts of Leeds. And at that point, he was then totally fine. So I'm like, well, that was your risk you decided to do. So anyway, so he was coping with the world, he was excelling in his training, and 6 months post remedy, he was considered to be the best behaved dog in a home of working dogs, which was a high accolade because his owners were very serious working dog trainers. Now, he did receive a second dose in November. So remember, his first dose was in January. So now we go to November 26, and he got a second dose of Breeder Carbonica 10M for a minor increase in hyperactivity and wariness of people. And this is not uncommon, as Andrea said to you, that normally in a chronic case, you're not going to fully resolve them with one prescription. Normally, it's a series of prescriptions over time. So because the symptom picture was minor, it was staying within the realm of Burrito Carbonica, and we had such a beautiful action before. I repeated the remedy, but I went up in potency, and his response was beautiful again. He improved gradually over several weeks with increased confidence, more relaxed with people, and his went completely normal behavior as far as border collie, working border collies are considered because they're always going to be manically hyperactive and excited about life. And so here's a picture of Taz, and he is such a lovely boy. And I loved him so much that the clients put me in their will to anything ever happened to them, Taz would be mine. So thank God, never needed to happen. So, in summary, these cases gave you a really just nice, simple series of examples to show you how we match the remedy to the patient's complete symptom picture. The remedy must create the same symptoms of illness in healthy patients, as Andrea described to you improving, as the sick patient. So, again, our similis curentar, a similar remedy will allow the vital force to cure the patient. So we expect to see a healing response on all levels. So this includes that rebalance or return of well-being, that increase of energy, and a return to optimal health, and the true ability to cure your patients. And as time goes on, they don't go on to form deeper diseases. You know, one of the ways that it didn't occur to me till I was in my own practice for about 10 years, where suddenly I was noticing, you know what? I don't deal with heart failure anymore. All my dogs with murmurs, they're not progressing because they all get constitutional homeopathy. And that was one of those profound moments where another light bulb goes off of like, gosh, look at the power of what we have to heal. You know, our patients can't help what genetics they're born with, but we can help them achieve what their optimum is for the life that they have with their owners. So I hope you enjoyed our presentation. Just to tell you a little bit about the courses we have on offer if you'd like to learn how to do this yourselves, and we'd love to help teach you, as we're very passionate about homeopathy, as you can tell. So we have our primary program, which is our full professional master course in veterinary homeopathy. We used to have our program separated in advanced and basic courses, but we've now combined them to offer a full program so that it is actually cheaper than a lot of the other alternative medicine courses where you have to take a basic course and then gradually work through your advanced courses to get your certification. So as we mentioned before, our program's been founded since 1992 by the pioneer of veterinary homeopathic education, Richard Pitcairn. We now offer more than 250 hours of live, and I want to stress live faculty instruction. So all of our lectures are delivered live in a very interactive, dynamic classroom environment where we encourage lots of discussion and questions. All sessions are recorded, so if students can't make that session for whatever reason, they can go and watch online. And what students love about the online learning platform now is that if they want to review a concept, they're walking the dog or they're going for a jog and they want to re-listen to a lecture again, they can. It's all there on tap for them. So we offer a comprehensive online program to facilitate the mastery of classical homeopathy. Our faculty team is broad ranging through small and large animal medicine, and together we bring about 265 years of homeopathic clinical expertise to you. We offer an integrative multimedia program, so we have live learning modules, we have intermodular webinars and case rounds to keep students connected in between our modular sessions, and we also have a student forum, and some of our faculties have our numbers available for emergency consults. So we want to really heavily invest in mentorship so that as you go through the program, you get the help you need to prescribe successfully. So our next course begins in spring 2026. But then also, because we've had so many requests from people that are not ready yet to spend the full tuition price to take the whole course, or they just want a basic course to get started with and get started with prescribing to see if this really is the modality for them, we're now offering an introductory course in veterinary homeopathy. So we're offering module 1 of our professional master course on its own as a standalone course. So it'll be delivered in the same manner. It's live online to give you a solid foundation of homeopathic theory and prescribing, focusing on taking acute cases and achieving the successful clinical results you just saw in this presentation. It's more than 50 hours of live faculty instruction over 3.5 months. And like I said, everything's recorded. So if you can't make a live session, you can watch online. And again, we provide you extensive mentor support throughout the entire program. Our next introductory course in veterinary homeopathy starts in just a few weeks, begins October 25th. Registration is open if you're interested. And of course, you can always send me an email after today and we can arrange a time to chat if you have any questions. So there's loads of books on homeopathy we'd recommend for introductory reading, and you can always check the book list for either the introductory course or the professional master course as really good resources for classical homeopathic texts. We definitely would recommend as a good starting place the Practical Handbook of Veterinary Homeopathy by Wendy Jensen. Also, Homeopathic Care for Cats and Dogs, Small Doses for Small Animals by Don Hamilton. And of course, Dr. Becarin's Complete Guide to Natural Health for Dogs and Cats by Richard Becarin. Now, that book is a whole health book. So it's got everything from homemade recipes, it's a complete whole health holistic book, but there are lots of nice homeopathic remedy recommendations for beginners in there. And then, of course, Dorothy Shepherd, she was an amazing human homeopath. She practiced from about 1906 all the way through the 1960s, and her books are fantastic. I definitely would recommend The Magic of the Minimum Dose. They're all really, really easy reads, and she has this wry British sense of humor, and they're just very enjoyable. For more advanced reading, we definitely would recommend The Science of Homeopathy by George Vitulkas. He's one of the modern fathers, like Richard Becarin, of classical homeopathy, and any of George Vitulkas's books are just fantastic. So I'd highly recommend them. And of course, the primary foundation literature of the science of homeopathy is The Organon of the Medical Art by Samuel Hahnemann. Again, this is a little hard to read because of the old language outside of a homeopathy course, but it's important we put it on the list. And of course, for more reading suggestions, please go to our 2 different book lists that you can read for introductory program, and then of course our master course to give you some good resources. And as students of the course, there are certain booksellers that'll give you discounts for buying books. And most of the books are, for the classical masters, are all out of copyright print. So they're fairly inexpensive to get online. So of course, if you want more information about our programs or you want to read journal articles about homeopathy, check out our library at our website, pivh.org, and you can contact us at info@pivh.org. Another really good resource for homeopathy that most of you probably know already is the National Center for Homeopathy, and their website is homeopathycenter.org, and they're just a wealth of so much information. So, Andrea, do you have anything to add before we delve into questions?
Yeah, I think if anybody is thinking they might want to dip their toe in the water, I know when I wanted to take the course back in 2006, the course was not available. It had already started that year. And of course, back in those days, there was not a sort of online mini course. I was able to get Module 1 on cassette tape, and I sat at my dining room table and listened to Module 1 on cassette tape. And I will tell you, it was extremely valuable and did ground me in basics of acute prescribing, allowed me to get a start on things, and also allowed me, when I did opt to go then and take the full course, have that already kind of foundation for really having the principles sink in, because this is not easy stuff to learn, and it's well worth listening to more than once or having presented to you more than once, especially from different speakers.
Yes, and something we've done with offering Module 1 as a standalone course is if you choose to take Module 1 on its own, that credit for Module 1 will then be applied towards you taking the professional master course. So we still would encourage you to start over from the beginning, but you then go on to take the professional master course, having completed officially Module 1 and get a discount off your tuition. So I hope you enjoyed our talk tonight. We could talk for more hours about how much we love homeopathy and everything that we've included in our program to make our students as successful as possible. But I think this would be a good time to open up to questions and hear what you guys like to know.
Yeah, we do have a question in the chat from Kathy L. From Dolores. Any course recommendations for non-veterinarians? And then we also have a question of how is your course different from the Veterinary Homeopathy Institute?
Okay, so for non-veterinarians, it depends on your degree. So we do allow other medical practitioners to take our course. So if you're a licensed veterinary technician or you're a licensed veterinary nurse, you're allowed to take our program. Other human medical practitioners, such as RNs or MDs, DOs, DCs, etc., are allowed to take our program. It's just because we teach our program at a certain medical level, if you don't come in with that prior medical background, you'll be lost. It's not designed for someone without that background. So there are, if you are a layperson and you don't have any other medical degrees, there are a number of courses out there. I would definitely recommend Will Falconer's Vital Animal courses. They're excellent. Dee Blanco, also her Wild Animal Bite courses are excellent. So you can email me and I can give you a list of other programs. So as far as what is our difference from the Veterinary Homeopathic Institute, the first difference is we've been around since 1992. They're only a few years old. They are started by two of our graduates. So the difference of your faculty experience level is much broader. So like I said, we bring to you about 265 years of veterinary homeopathic expertise. All of your faculty and mentors in the program use homeopathy as their primary modality. So that is a really big difference. So we only use homeopathy in our practice. So our clinical expertise level, you will not find any higher. The other difference in our program is that in order to truly learn how to prescribe for chronic disease, that takes time. So as you saw with Taz's case, we worked with Taz over months. I didn't walk you through every appointment where I reassessed him, but that was quite a simple, easy case to show you. Most of our chronic disease cases come burdened with a heavy level of genetic disease. You know, we're seeing puppies sick with all kinds of joint deformities and problems from a very early age. We're seeing a high propensity of hip dysplasia. We're seeing puppies with full-blown allergies and atopy or IBD by 6 to 9 months of age, etc. So when you get these young animals or even older animals where you're dealing with lots of complex multi-layered chronic problems, you need to follow those cases over a long period of time to truly work through and understand if you're on the right path. So that's one of the big reasons why we turned our basic and advanced program to one program, because we deliver the program over 18 months, but you actually get a full 2 years of faculty membership and time to complete all your casework. So in that time, you receive mentorship to follow those cases through to really know if you're on the right track. Because with those complex cases with patients that can't talk to you, you'll often start off on what Andrea called a partial prescription. So you might initially get a good response, but as you repeat the remedy another month or two later, you start getting a diminishing reaction and you realize you need to select something else. Well, if you only have a short course, then you run out of your faculty membership time and then you're left with, you're out of the course and now you don't know what to do with them. So part of the reason why we structured our program's length the way it is so that by the time you leave the program, you will be fully confident to work through complex chronic cases with multiple problems. We are also a very strictly classical homeopathic program, and we're bringing you the experience of the last 200 years of old masters' work, along with our own faculty experience work. So we each have different subspecialties and different species. So we can give you all of our, each 20 to 40 year experience of working with the species that we focus on. So I think that's just highlighting the little differences between the programs. So, I always say to people that, like, if you're passionate about homeopathy, you really want to learn how to do it and make this like one of the main modalities in your practice, then you really need to take a longer, more serious program, because otherwise your training will be more superficial and you won't be able to achieve the successful results like we just discussed with you in this presentation. Andrea, is that a good explanation? Do you have anything to
Yeah,
add?
yeah. What I'd like to add is that one of the most valuable things that I have derived from teaching, helping to teach this course since 2016, is when I'm teaching the course, I'm retaking the course. And this has reemphasized these very classical, original concepts of homeopathy that have made me so much better a practitioner, to have those reinforced. And so I can tell you that I've been both a participant in this course, but almost sort of indirectly a student of the course as well. And I've done a lot of continuing education in homeopathy in all kinds of venues. I have had nothing more valuable than this restructured course that Dr. Stieg has built. And I've helped participate in a bit as well. This, to me, I've looked at a lot of different homeopathic programs. I've talked to a lot of people who've gone to different things. The foundation we give you is really second to none. And the time, working with chronically ill animals, it is not unusual for me to take 6 months, a year, 2 years to move a profoundly unwell, especially purebred animal to the best place of things. If I was done with a course in short order, I would not have had the time to learn the concepts or the mentorship to help me interpret what was happening in those cases. Because while we talk about the miracles that can occur, we also want to be very realistic in understanding that many of these animals are on a lifelong journey to maintain and optimize their health, especially animals who come to you with, a lot of chronic disease burden.
As well put, Andrea. Thank you. Because ultimately our goal, what do we want? We want our students to be successful. I want to see each one of our students be as successful as we are and surpass us in your career. So having moved to the UK and seeing, worked with different schools in Europe and seeing the deviation from classical homeopathy, I can definitely tell you that it absolutely affects the successful prescriptions of their graduates. And if we can't teach, if someone can't teach you to prescribe correctly, then what happens? You don't continue with homeopathy. So I can absolutely tell you from our graduates' experience that we can deliver you a program that works, and we're very passionate about supporting you through it. So feel free to unmute yourselves and ask a question if you have a question.
We've had a couple questions about Cushing's disease. I would just say, I could just address Cushing's is very deep-seated chronic disease. It is a disease of the endocrine system, and the endocrine system, meaning the system that produces hormones in the body, is a system of fundamental control in the body. Approaching a patient with Cushing's disease does require advanced training in management of chronic disease. I would love it if I could tell you, here's the remedy for Cushing's disease, but it doesn't work that way. So are there Cushing's disease patients who can be helped with homeopathy? Yes, there are. Does it require a great deal of skill on the level of the practitioner and commitment on the owner and an understanding that this is something that is going to take time? Yeah, all of the above.
And of course, it also depends what species you're talking about, because equine Cushing's, I actually find way easier to treat than canine Cushing's. Equine Cushing's responds phenomenally well to homeopathy, but they're different diseases. They function differently on, for your non-vets in the room. Canine Cushing's is a disease of the adrenal gland usually, where equine Cushing's is a disease of the pituitary gland in the brain. So they function a bit differently, but homeopathy is fantastic for equine Cushing's. Canine Cushing's, yes, definitely helpful, a little bit more challenging, but I would definitely encourage you to, especially for your horsey people in the room, to either pursue homeopathic training for all those endocrine diseases in horses, or pursue equine veterinary homeopath. And if you are equine owner and you're looking for an equine veterinary homeopath, just email me and I can recommend people to you that if they're not in their area, they're willing to work over the.
So is there a system set up on some of these patients that come in on pharmaceuticals long-term? When you talk about your Cushing's would be one example, or your heart patients that have been on pimobendan forever, but they're just not thriving with it.
Yeah.
To incorporate the homeopathic while weaning them off of the pharmaceutical?
Yes, absolutely, because you cannot rip them off the pharmaceuticals.
No.
Everything has to be staged, and depending how you wean someone off allopathic medication, it depends on the kind of medication. A lot of things can be stopped quite quickly, like antibiotics, but then other things, steroids, pimobendan, etc., that's something you gradually wean them off. So it's definitely a big topic in the program. So we spend a lot of time talking about it. And again, we stage everyone's learning as we work through more and more complex chronic cases throughout the course.
So if I can, that would extend, then you're saying that a lot of your instructors are classical homeopathic practitioners, but yet, I work with, I'm in an integrated clinic, but I work with mostly herbals and acupuncture, what have you. And people will come in now with the internet. They are on so many doggone different supplements from different people, trying to treat allopathically with what I see are more. So is that another thing? Is part of your goal to get them only on homeopathic?
Well, it depends what they're on. So it really depends on what they're on.
Same thing I'm doing now. It depends on what you're on.
Yeah, because it really depends what you're on. There's certain herbals that are more nutritive, nutritious for the body, versus herbals that actually act like a drug. So this is where we have to decide what's a drug effect and what's a supportive effect. Because if it's
like to say when I have somebody that comes in on homeopathics that they say aren't working. It's the same. It goes around the board, and where I live, there's nobody in person, for
Yeah.
that area. So I end up going, okay, I don't know much about those.
Yeah. So what I could tell you in just a little sort of capsule thing is, as Sarah and I have each become better and more experienced homeopaths, our reliance on the nutraceuticals, the probiotics, the this and that has become less and less, because the more skillful you become as a homeopathic practitioner, shifting the fundamental health at an energetic level, the less all of these things which work at a physical level, and sometimes necessarily so, become less key to the patient's progress. And so, when I'm treating I have a patient recently who had essentially zero vitamin B12 in his system. The main reason the patient is getting better is because of my homeopathic prescribing, but I have supplemented him with vitamin B12, with my goal being, if I'm doing my job correctly, he's not going to need that forever. And so it's simply understanding that all of those things work at the physical level, and we are trying to get more fundamental than that.
Yes, it's like the better you get, the more laser-like you are with your prescriptions, and the faster the responses you see, the shorter amount of time it takes you to find that patient simillimum, and it's all about experience, which is why, Andrea said the benefit to us teaching, we also retake the course at the same time, and our prescribing gets better year on year. So, and I would definitely say, I'm not sure when you say people are coming in on homeopathics that are not working, there's a lot of what we call allopathic homeopathic prescribing out there, that where people are using homeopathic remedies in an allopathic way. So they're using them like drugs. They're putting them on them daily. They're using combination remedies. And that's not classical homeopathy. And I know that homotoxicology is like, I always joke, we call it like the gateway drug to homeopathy, that a lot of people start with homotoxicology. And I always tell people that if you like the effects from homotox, let me tell you, we can increase that by 1,000 times with real homeopathy, because that's not real homeopathy. That's using homeopathy in an allopathic way. So go ahead.
Yeah, we have another question that I think is really interesting. Dina asks, how do you approach a patient that presents with an acute symptom but has a long-standing chronic issue? For example, a cat with herpes since birth that presents with a more recent acute condition. I'm going to tell you that as a homeopath, I look at that as an opportunity, because what I can do for many patients with an acute flare of a chronic disease is that I can often make a prescription for that patient's state that improves them significantly without a lot of ordeal or side effect, shows the owner the power of homeopathy. But at the time I'm making that prescription, I am conveying to them, I'm going to try and help your cat in this acute situation. And it's very likely, if I prescribe correctly, your cat's going to get better. But this is not the cure. And if we want to prevent these future flare-ups, we're going to schedule a full consultation where I'm going to take your whole chronic case and treat you constitutionally going forward. So that patient, that example, is an opportunity. Now, for many individuals, and this is very common, say, in India, where homeopathy is a first-line homeopathic methodology for many of the poor, many people will only get their acutes treated inexpensively and readily by a homeopath and never have their chronic case taken. And there's nothing wrong with that, but that is not the highest goal of the highly trained homeopath. So it's, yes, we can help the acute. We'd like to address the chronic if we can have the opportunity.
Because that's how you achieve truly a higher plane of health. Because if we don't address the chronic disease of the patient, it's just going to keep growing, and they're going to keep presenting with more acute problems until their chronic disease problems start becoming overwhelming and become a bigger issue. So, right, we have another question from Elizabeth. I have a border collie who has behavioral issues. Do you think homeopathy could deal with the emotional hyperenergy and chase drive to help him to learn? His mother died at birth, so he never had mother correction. Ooh, that's interesting. Would that be considered for homeopathic treatment? Absolutely, because you sound like you have a developmental case.
Yeah.
You didn't get the right maturation process and behavioral training. So, absolutely. Will it make him not a border collie? No,
No.
he'll still be a border collie. He'll still be hyperactive. But what I find with the right remedy is it just dials down that unwanted behavior to a level where they can start thinking and then the training works. So I work very closely with other dog trainers and behaviorists, and my job is to get the patient to a state where then you have that supportive training come in and then they can relearn in a positive way what they're supposed to be doing or the correct behaviors. And it's such a lovely combination. So you have to think of it that the remedy is helping the patient return to a place where they can actually start thinking and learning and functioning. So absolutely, that's a great
Yeah.
example.
Yeah. And this reminds, if we think about the definition of health in allopathic medicine, the definition of health is almost a negative definition. It's the absence of disease. That's how allopathic medicine defines health. Oh, no disease, then you're healthy. The homeopathic definition of health is to allow the individual to live to its greatest potential. That's what true homeopathic health is. And so this acknowledges the individual differences. A border collie is still going to be a border collie. A terrier is still going to be a terrier. A Persian is still going to be a couch potato. But all of these things, it's if they are treated constitutionally with homeopathy, that patient, for whatever burden they come with, will be able to go to the best potential that they can have.
Okay, we have another question in the chat. Someone requesting an phone homeopathic consultation for their dog that has complicated chronic disease, Cushing's, and cancer. And so, if you don't have someone in your area, if you go to the PIVH website and go to the referrals page, we do have a separate section for health consultants. So if you go to the referral page and you look to the right, there'll be a box right there for health consultants. And if you click on it, that'll take you to a list of homeopathic vets that are classically trained and willing to consult at a distance. And so I'd recommend you start there. If you'd like any other specific individual recommendations, just go ahead and email me and I can address that. But that's a good list of very excellent practitioners. Do we have any other questions? I know earlier on people had some questions about software and such. Are any of those people still on and have any questions about homeopathic software?
Yeah. I would just say there is a software for almost any price point. You do not have to invest thousands and thousands of dollars to have homeopathic software that is functional enough for you to know, is this something you want to do? Will it allow you to grow? That's really, really important, that it should not be a barrier.
No, and you can do just hand analyses.
Yeah.
It's just most of us are in such busy practices that we really prefer our computer software. So the main companies are Radar Opus, Synergy, and Complete Dynamics, and they will put together student packages of different levels for our course. And so if someone's really wanting a budget package, I mean, Complete Dynamics, they do monthly fee of inexpensive of €7 a month, which is very close to the US dollar right now. So basically less than $10 a month versus you spending, say, $1,000 or $2,000 on a bigger package. So I always tell people, don't buy homeopathic software until you're in the course if you're a student preparing for the course, because we get you good deals. That's my job, is to wheel and deal for you. So I will definitely get you a good deal. And like I said, they have different price points, from anything from very inexpensive monthly fee to payment plans, to packages that are just a few $100s. So it's definitely affordable, and there's price points and payment plans for everybody. So don't let the software be an obstacle. And just like the books, like we're so used to our veterinary textbooks being horrendously expensive. Just to remind you again, most of the classical homeopathic texts are all out of copyright. So they're printed very cheaply in India, and you can find them online from various homeopathic book suppliers. Obviously, there has been some tariff change recently about overseas shipping, so you'll need to see what current supplier prices are, but it's fraction of the cost of what veterinary textbooks would be. Anything from $10 to $40 for a lot of the books.
Yeah, I've built a very big library relying mostly on used copies of Indian printed books, and it has not been an exorbitant outlay. And if you do spend money on larger homeopathic packages, these reference libraries are part of the more expensive packages.
Yeah, so for Synergy and Radar Opus, you'll get a massive library of books, and it depends what package level you buy, but you'll get a huge library of books with them, that will exceed your desires in time, as well as not just books, but they have lots and lots of old medical journals. So you'll just have a wealth of information there. So, they're really useful. But yes, just don't let that be an obstacle. And we do go through in the program, we show you the different programs so you can get a feel for them. Some of the companies will do demos, they'll do free demos to work with you. Radar Opus is most popular with our students. They find that the easiest to navigate. And then Synergy and Complete Dynamics, it just depends on people's price points, what they want to use. So, and then frequently I can still get Radar Opus to do, student discounts after the course, to catch our graduates when they want to upgrade. So yeah, so there's definitely lots of options. I think, did that cover your questions about costs for programs? Feel free to speak up.
Yeah, there was also the question about some costs of the course itself, and all that information is available on the website.
Yes, I would just like to state that to point out that people often look at the basic price tag and fail to look through all the different payment options. So you can either pay for the course all at once to save any processing fees, or you can break it up into 2 or 4 payments. You can pay by check, credit card, or bank transfer. For our international students, usually prefer Wise bank transfer. That's the cheapest with very minimal fees. So I usually encourage people that, if you're, cost is an issue right now with the economy and the way the global economy is going, choose the 4 payment option. If you sign up now for the course next year, you can break that up into multiple tax years, so, we can help you spread that out so that it's a lot more affordable. If even the 4 payment is difficult for you, contact me and we can work out a personal payment plan. But I know most of us in business, like working with our tax years is our big issue, and trying to spread those costs over multiple tax years is really, really helpful. So definitely email me if you have any concerns about costs. Did that answer all your questions, Ash? Because I know you had quite a few questions, so I think so. All right. Someone else asked, is homeopathy more accepted in India? I would say yes, there is still a strong dichotomy in India between homeopathy and allopathic medicine. There's a very, very strong cultural dichotomy. But homeopathy obviously was founded by Samuel Hahnemann in Europe and then just spread all around the globe. We had a massive homeopathic medical system in the United States. And what most people don't know is that the American Medical Association for Allopathic Physicians, it's still in existence today, that was founded 2 years after the American Homeopathic Medical Association started to combat homeopaths. Because the problem homeopaths have always found is they were so successful that all the wealthy clients, like all the industrialists, like Rockefeller, etc., all the big philanthropists, the Vanderbilts in America would flock to the homeopaths, would fund the homeopathic schools. And then in Europe, all the monarchies, including the British monarchy, are passionate about homeopathy. And so you ended up with these competing financial issues. And so there's been a huge political battle for basically for your client pool and for funding. And it's really interesting when you follow that funding and that struggle throughout the 1800s to early 1900s, you can see you can see sort of what happened, why homeopathy fell out and didn't become the dominant paradigm anymore, purely because of politics and finances. But what's really fascinating is when you go back and you actually look at how big homeopathy was at the time, because most people don't realize that it was such an established medical system. Andrea, do you have anything to add to that?
Yeah, I remember when I went off to veterinary school in Philadelphia in 1984, Hahnemann Medical College was still by that name. It was no longer homeopathic. It had stopped being homeopathic in 1959, but it was still called Hahnemann Medical College, and then it's changed. And I was like, well, who the heck is Hahnemann? But it was just, Philadelphia, Chicago were immense centers of homeopathic education, and yeah, people just don't know about it. In India, as I said, the division is often a bit by income, and it is the homeopathic things are often helping treat poor people because the medicines don't cost a lot, and the more affluent clientele has been more, in general, westernized. I personally have a client, a lovely woman she was born here in America, but her family is Indian, physicians 4 generations back. And it was with her parents that they stopped being homeopathic. So her parents became the conventional things, but her grandparents and her great-grandparents were homeopathic physicians.
Well, and the nice thing about us being able to be fully 100% online now is that not only can we give our students the kind of contact hours that they deserve and need to be good homeopaths, but we're fully international. So we have students from India, Australia. In the last class, we had students also from Singapore, Europe, Sweden, etc. So it's really nice to be fully international, because in India, they don't have a comprehensive homeopathic veterinary course. The
Yeah.
only course on offer is just a few months long. So so there is that desire and need there. So all right. Does anybody else have any other
Yeah,
questions?
I have one. Um, Relative to cancer, have you ever brought a cancer case to cure, like a dog with nasal cancer or sarcoma?
Oh, yes. So, yes, I haven't, but one of my students has, because it depends what we're all presented with in practice. So, cancer is so wide and variable. There are so many different types of cancers and so many different levels of full systemic destruction. The easier cancers are the more localized cancers, and definitely either us or we have colleagues that have cured them. When you get the full systemic body breakdown stages, often coming to us after loads of intervention, those cases I usually tell my clients that at this stage of breakdown and end of life stage, we're looking to give them the highest quality of life. And what the beautiful part about homeopathy that I see in cases that aren't curable is that not only do they live the same amount of time as if they received allopathic treatment, they usually live longer, and the quality of life is astounding. They get back to playing, they get back to enjoying their daily life, they look better, they feel better. It is such a contrast, and I can't push homeopathy more for that kind of deep level of disease. It's so helpful when prescribed correctly.
Yeah.
So does that answer your question?
Yeah, so there's no magic wands out
No.
there. We wish there were, but that is very much the case. My own cat, I lost a beloved cat of mine to oral fibrosarcoma, but she had 11 and a half months from the time this first pathology was noted until I decided to let her go with not a bad day, not a bad day, and that's something to be said.
Well, I'll leave names out, but I worked with a well-known homeopath who was using some combination, although claimed to be classical, combination of remedies, and things like Hecla and nitrum and,
Hmm.
bouncing around. And my dog's nasal cancer, which was localized, just kept growing and growing. It's like it wouldn't stop. And it actually extended outside of her nasal passage at one point and then affected her vision, which,
Mm.
it seemed like it was out of control and it just seemed like nothing would stop it. And I was just very curious as I'm glad to hear that you've had success. Maybe it was just a matter of the wrong homeopath, or other things, probably operator error on my part, but it just didn't seem like we could ever get any results.
Well, for some cancer cases are just really tough. I'm always honest with people. Like, no one medical system has the 100% dial in tip on cancer. However, classical homeopathy in cancer cases can achieve such amazing results. And what you just described is not classical. It sounds like it was the Ramakrishna method or maybe the
Yeah.
Sankaran method. And I have seen, so as we discussed before with homotoxicology, when you use homeopathic remedies in an allopathic way, all you are doing is either suppressing or palliating. So you're
If
not
that, if
if
that.
if that. Yeah. So you're either suppressing the symptoms or temporarily palliating them. You're not going to be able to achieve the true curative results. So I would say that you definitely need to seek. I don't know if your doggy is, still with you, but
No, it just once she lost her vision, it was
Yeah.
and
yeah.
and it couldn't and interesting had the B12 problem. And every time she was given B12, it would exasperate the tumor, it would inflame. It was just also weird.
Mm.
Um, but because I basically was just trying to find, uh, I wasn't even looking for a cure anymore. I was just like, can she live with the cancer and have well-being, which is possible, but it
Yes.
just didn't happen. And I'm so
Yeah.
sad about it, but I'm so
It's
glad to hear that you both have had results because it helps to hear that.
Yeah,
yeah, it's
there are
definitely.
many folks trying to tackle cancer, and they're doing it with good intentions. There's no bad intentions behind this, but there are these sort of pre-written protocols, and for many cancers, it's this remedy and that remedy and alternation and potency. And I respect their intention to help, and some of these practitioners have some very good statistics about individuals in the short run. But the bottom line is that is an allopathic, that is a cookbook, non-individualized way of addressing things. And it's much easier. It's much easier to do that. But the results at their very best could never duplicate what true individualized prescribing could do at its very best, recognizing that even at that level, the patient still may not be cured. But we're trying to help that patient maintain their best potential for the state they're in.
Right. Yeah, I don't know why they referred to themselves as classical because I even asked and they said they were classical because I thought it was an unusual approach
Yeah,
myself.
unfortunately, that is not an uncommon experience, and so this is something we try to change within our program and institute of really encouraging people, what is classical homeopathy and how to achieve those high success because there's a load of people out there practicing that use that phrase, but it's not until you inquire about how they practice whether or not you realize they're truly classical. And it's very, very hard as a client to know the right things to ask unless you have some kind of homeopathic training.
Right. Well, thanks for sharing that. And this he had been a homeopathic vet for 30 years plus. I mean, and is well known. I don't really
Yeah.
understand any of it, but
Well, I think, a lot of people to be a very good classical homeopath, you have to really fundamentally make that medical paradigm shift. So this goes back to everything Andrea discussed at the beginning of our talk, because I think the best way to put it, Richard Buchanan, he always discussed, the best way to explain homeopathy is through quantum physics, right? And that we're talking truly about energetic principles. And let's put it this way. Every aspect, every field of science has accepted the principles of quantum physics except one. What is that? That's medicine. Medicine is the only field of science that has not accepted the principle of quantum mechanics. So, that being said, if you think about how people are taught to view the world from the time they're small children, that paradigm of medicine, of scientific materialism, is so pervasive from the time we're taught to think about science as little kids all the way through our school and our teenage years, through university, through medical school. To become a homeopath, you not just have to unearth your veterinary school knowledge about how to view the world, going from scientific materialist to a vitalist model, but they're actually really deep seated. And it's not until you've been working through prescribing for years and really pushing yourself that you realize how deep rooted those views of scientific materialism are. And the reason why I'm going into this explanation is because I think that's why so many people that have practiced homeopathy for a long time end up still diverging into more allopathic prescribing. It's because they haven't fundamentally at their core embraced the vitalism approach. And it's a personal choice. It doesn't matter how well we teach the program, it all comes down to a personal choice and something everybody has to work on. So
And again, it's I don't think anybody's being duplicitous or trying to be dishonest about it. It's really just not quite understanding and grasping things at the most fundamental level. I also see that in many cases of patients that I have had who've been treated for a variety of things homeopathically, the art of the progress report and following the patient carefully after every dose of a remedy is not substantive. It's lacking. And I have seen patients who were prescribed remedies and said, do this for a month and then, let me know how it's going. Where we will teach that when a remedy is given, there is a scheduled follow-up at the proper time interval to understand how did the patient respond. Suppressive, palliative, curative, no response at all, because that is the only indicator to then know what to do next. And it requires an incredible amount of individual time commitment on the part of the practitioner and the owner. It's not easy. It's not for everyone. But that's what we're trying to teach, because in cases of any serious chronic disease, cancer falls under that, you will not be able to progress to the best you can if you don't have that very structured format.
Yeah, and we teach you, so for those of you who are in the room that are still thinking about taking the program, that's part of what we teach you in the course. And we talk a lot about, business models and, how you need to adjust your business structure to accommodate for that, for you to be successful. And, so it actually works within your practice. Andrea, we had, which was going to be the next thing I was going to go on to. Dina asked, what are some basic questions to ask a homeopathic vet to determine whether they are practicing true classical homeopathy?
Well, Dr. Pitcairn on his website has a list of these questions to be asked. If you go to drpitcairn.com, there is, it may take a couple clicks through menus of things, but Richard very specifically laid these questions out. And it has to do with, she's put the website there. There's a list of questions there. And these questions are applicable for someone seeking a human homeopath or a homeopath for their pet. I have had one person call me and start asking me those. It's like, I know these questions. They're Richard's questions. I'm going to give you all the right answers.
Oh, yeah, but basic things like, do you ever give more than one remedy at the same time?
Yeah.
Do
Have
you,
you
you know,
studied the organon? Do you use unproven remedies? All of these things
Mhm.
factor in. Are you, are you continuing medications at the same time with remedies in the context of, could these medications perhaps safely be stopped?
So Dolores asked another great question. In your case studies, you used 1M and 10M potencies. Are the more readily available 6C and 30C remedies beneficial in chronic or acute cases? Absolutely. So the cases I presented to you, I chose those potencies either because I was in an emergency with something that was happening very fast, either, Penny with a lot of pain, high vitality, such as the dove or marmite young animals. And in Taz's case, again, high vitality young animal. A good homeopath, the master homeopath Kent, he's a very famous homeopath from the the 1800s, turn of the century 1900s. He wrote one of the best repertories in homeopathic medicine called Kent's Repertory. He said a good homeopath should use the full range of potencies, everything from a 3C to an MM. So you select the potency based on a variety of things, the patient's vitality, the degree of their illness. In say, a deeply ill chronic case where you're concerned about causing too much reaction too quickly, you need to take it gently. You're going to start with a lower potency. So absolutely, the full range of potencies are useful in practice. I do find with patients with postoperative pain, trauma, extremely painful conditions, I do find they respond better to higher potencies. And I'm talking about acute conditions, not necessarily someone in a chronic state that has a chronic back problem. That's different. That's chronic. But when we're talking like acute trauma and injury, I find people need less doses if they use higher potencies. So hopefully that helped answer you. So by all means, please embrace and use the 30C. And just remember that Hahnemann himself mostly worked with just up to a 30C. He did have some higher potencies, but the real high potencies weren't really evolved to the mid 1800s and afterwards, because it took a lot of work to do that manually.
Yeah. Especially in acute cases.
Mhm.
If the remedy is right, the potency becomes secondary. It's nice if you have a range of potencies to work, but if a client didn't have the right potency but had the right remedy, I'd say give it in whatever you've got, and
Oh, yeah.
that's borne out, great fruit. So it's in chronic disease that becomes, I said, using the repertoire of potencies allows you to have the bigger toolbox, and in chronic disease you need a bigger toolbox than in an acute disease.
Mhm. Yes, the right remedy always bears out the right potency.
Yeah.
So that was an excellent question. Uh, all right. Well, I know we've been on for a long time. Are there any other lingering questions before we sign off for the night? Excellent question. Kathy L asks, at what stage of the course can you start prescribing? In module 1. We teach you how to prescribe immediately. So your first few days of lectures are grounding you in that theory, but by day 3, we're starting to teach you the framework of how to prescribe. And the importance is because you can study homeopathy all you like, but until you start actually doing it and seeing it come alive in front of you, that's where the real learning happens. And this is why I've integrated a problem-based learning approach into our program. So I went to 100% problem learning-based veterinary school, Western University of Health Sciences in Southern California. And I took the best parts about problem-based learning and integrate it into our program so that you work through cured clinical cases in class like you are the practitioner at the time. So we used cured clinical cases so that when we get to the end of the case, you know if you were right. You know if all the work you did in class was correct and where you need to tweak your thought process. But we use lots of PBL cases during the course for you to learn how to take a case, make a symptom list, identify what are characteristic symptoms, do analyses, find the right rubrics, and then select potency, look at a differential list, how to differentiate in the materia medica, and then, of course, going through all the follow-up, and then how to make those follow-up decisions about when to repeat, when to change, etc. So we basically hold your hand electronically through lots of practice cases to make sure you can get started prescribing right away. And students love it. They have found it so helpful and really increase their confidence.
Yeah, and I think this would be also, I think, a distinguishing feature between our program and others that are out there. I was not familiar with problem-based learning. My education was basically sitting in a chair and having people lecture at me. And having been taught by Sarah to teach in a PBL fashion, I see the difference in how it helps me teach better and the amount of information assimilated by the students being vastly, vastly different.
All right. Well, if there's no other questions, we thank you guys so much for your attention tonight and giving up your Sunday. We hope this was useful for you and interesting. So we'll go ahead and post the recording and send out a link when that's available in the next couple days for anyone if you want to watch and review and swat up, as we say in England. But anyways, thank you so much for your time and happy studying homeopathy. Good night, everyone.
Thank you.